Hey, Eyes and Shine, Dr. Allen here. So how can we slow down myopia or nearsightedness from getting worse? In the eye care field, we refer to this as myopia control or myopia management, and sort of a subspecialty that's been growing in the eye care field, with the whole goal of myopia management to slow down the axial length of the eyeball or the lengthening of the eyeball that occurs during our adolescence to further reduce the risk of any of the associated eye diseases that come with that later in life. Now, there are several strategies for myopia management that your eye doctor may be able to offer you and your loved ones. Everything from lifestyle changes to specialized contact lenses or prescription medications to even some new eyeglasses lenses and some other technologies that are coming out in the research just around the corner. So in today's video, we're going to break down some of these options so that you know what's available and what might work better for you and your family. In myopia management, we can categorize these treatments as optical, pharmacological, and lifestyle treatments, with the most effective treatments slowing down the lengthening of the eye by at least 50%. So the first thing that most eye doctors will mention are lifestyle factors, such as encouraging a child to spend more time outdoors and less time doing things up close on digital devices outside of normal schoolwork. While I think these strategies are important for all children, unfortunately, it's not super clear in the research how well this is going to affect the progression of nearsightedness. Instead, it shows more significance for maybe delaying or preventing the onset of myopia. So if somebody is already nearsighted, that's where these next strategies are going to become very important. First, let's talk about atropine eye drops. Atropine eye drops have probably been the most well-researched and most widely available across the globe as a treatment for myopia management. Atropine eye drops work by relaxing the eyeball's focusing system and therefore helping slow down the growth of the eyeball. The current research does suggest that using about a 0.05% diluted formulation of atropine is the most effective at slowing down the axial growth, again by at least 50%. Thankfully, atropine is prescribed usually only one drop in each eye right before bedtime, but your doctor will recommend specific instructions based on your child's needs. While atropine eye drops for myopia are usually very diluted concentrations and generally well tolerated, they sometimes can come with some side effects. Most common are those of light sensitivity when outside, and on occasion, harder time seeing up close. If that's a situation, then don't be surprised if your eye doctor recommends wearing sunglasses outside or prescribing reading glasses for near work tasks if that happens to be a problem. Research on atropine eye drops is always ongoing, including new formulations and new percentages, so it's always good to ask your eye doctor what they think is going to be the best for you, your family members, and their overall thoughts on what might just work the best. So now, let's review some options for contact lenses. Let's start off with talking about what is called orthokeratology, sometimes referred to as just ortho-k. This is where a special contact lens is prescribed to be worn at nighttime while you sleep. And during that time, that contact lens will gently reshape the front surface of the eye so that the next morning you can take out that contact lens and be able to see without glasses and without wearing contacts during the daytime. And what's great is that ortho-k lenses have also been shown to slow down myopia progression by at least 50% and offer some unique benefits, especially for children who either don't want to wear glasses or perhaps are involved in sporting activities such as swimming where wearing contact lenses is usually not recommended. I did do a video previously going deeper dive into orthokeratology, so if that's something you want to learn more about, I will put a link to that video in the description below for you. But another contact lens option for myopia management includes that of soft multifocal contacts. These are very similar to just any other soft contact lens, but these ones also have a special optical component that induces a gentle myopic defocus, which really helps send a different signal to the eye to not cause it to grow quite as long. There are a few different brands of lenses out there, including the CooperVision MySight One Day lens, for example, but there are a few other options too. too. So be sure to ask your local eye doctor what they think is going to be best for you and your family member. As far as slowing down myopia, research shows that most of these multifocal soft lenses can slow down the progression by at least 50%, but it does depend on the brand selected. I know sometimes parents and guardians are a little hesitant about starting a young child in contact lenses because contact lens care requires a lot of care and hygiene, but it's really not uncommon to see good success in contact lenses for children as young as 6 to 8 years old. If you happen to need some extra tips on contact lenses, putting them in, taking them out, anything like that, I do have a full video playlist all about contact lenses. And again, I'll put that in the description below the like button for you. All right, now let's talk about eyeglasses lenses for myopia. Thankfully, there have been some new lens technologies in the research that are showing to help slow down the eyes from becoming more nearsighted. 3 of the lenses that have been in this research include the Essilor Stellest lens, the Hoya MyoSmart lenses, and then the SightGlass DOT lenses, with the preliminary research showing that these lenses can slow down myopia progression by at least 50% if the glasses are worn more full time. However, these types of lenses are currently not available everywhere, such as here in the United States where I live and practice. They are currently not FDA approved just yet at the timing of this video. So definitely ask your local eye clinic what may be available for you in your area and what they think would be best for you and your family. However, stay tuned because we will do some deep dives into these different lens technologies as they become more available. And if you had previously caught one of our videos on red light therapy for the eyes, red light is currently being investigated as a potential treatment and therapy to not only slow down myopia, but maybe even prevent it from occurring. And while that technology is currently available in a few select countries throughout the world, it is viewed to be very much in its infancy and heavily in the research phase, especially around safety for the eyes. So definitely stay tuned to the channel because we'll report more on that information as that research comes out. And then finally, I just want to comment on both appropriate follow-up for myopia management as well as the potential costs of these different types of strategies. When it comes to follow-up, expect that a doctor is going to want to see a child at least every 6 months or maybe sooner depending on what type of technology is being employed for myopia management. Usually the doctor is going to want to at least check a glasses prescription to see if that has changed at all or progressed, as well as perhaps taking a measurement of an eyeball axial length, depending if that technology is available. This is just a way for the doctor to assess if myopia is indeed progressing and if any of that technology for myopia management is being effective. Now, cost of these myopia management strategies are a little bit tricky of a thing for me to be talking about comprehensively in this video, just because there is a wide range of cost for these therapies, depending on the treatment option that's selected, as well as the individual doctor or clinic that you may be going to. On the low end, cost of something like Atropine eye drops could cost anywhere from $10 to $50 per month, depending, of course, if insurance covers that medication. Or it could cost several hundreds to even several thousands of dollars for something like specialty glasses lenses or specialty contact lenses, again, depending on the individual treatment as well as the service fees from that provider. Well, of course, it's definitely important to weigh the cost benefits of all these options. I think it's just important to recognize really what you're investing in your child's health and future, not only their ability to see well, but preventing future health issues down the road. Now, I know we covered a lot of information in this video, so if you do have any other questions, please let me know in the comment section and I'll do my very best to get back to you or make a video to try and answer your questions. If you do want to learn more about any of the specific treatments we talked about, I will have some playlists coming up here to the side. Otherwise, I do wanted to say thank you so much for watching, and kudos to you for taking such an interest in your own eye health as well as the eye health and vision of your family members. Keep an eye on it, and we'll see you in those next videos.